Good evening, everyone, and welcome to our session. I am Dr. Tarini Puri from Voice of Healthcare, and I welcome you all to another episode of Expert Dialogues titled Empowering Oncology Through Nutrition that VOH and ESPROR have planned for National Cancer Awareness Month. This session focuses on diet in cancer and how diet impacts diagnosis and outcomes with therapy in breast cancer. Today, we have with us an expert in the field of oncology, Dr. Rakesh Pinninti, who is consultant medical oncology at Basavatarakam Indo American Cancer Hospital and Research Center. He has over 12 years of experience and has served both rural and urban populations. Good evening and welcome to our session, Dr. Pinninti. It's a pleasure to have you today.
So good evening to all the viewers. Thank you for having me here. I am a medical oncologist, and as a medical oncologist, I take care of most of the diagnostics parts as well as the treatment planning. I take part in the multidisciplinary meets in which we plan treatment for our patients. So basically, what we understand is that most of the patients are also having a lot of concerns regarding their outcomes and why the disease happened, what could have been done to prevent a disease, and also in the future, what could be done to prevent a recurrence. So that is what we are going to discuss today with specifically breast cancer in concern.
And now, to begin our session, I would like to request Dr. Pinninti to brief us about National Cancer Awareness and Prevention Month.
So the National Cancer Prevention Month or National Cancer Awareness Month, this was initiated in the year 2022. January of 2022, it was decided that every year, the month of February was to be taken as a National Cancer Prevention Month. So during this month, there was an opportunity to basically to improve the awareness about the cancer prevention strategies, uh, promoting healthy lifestyles, and also encouraging regular screening to identify a diagnosis at a much more earlier stage. So this is happening from the last 3.5 to 4 years, and today it is an opportunity for us to discuss the methods in which we can prevent or reduce the risk of breast cancer per se, identify the breast cancer much more early, what are the treatment opportunities that are out there in 2024, and how diet can make a impact for both prevention and during treatment, how to cope up with the treatment that is going on. And post treatment, we'll also look at strategies to prevent a recurrence. That is what is the agenda for today.
Thank you for that introduction. So, now moving on, could you tell us about the burden of breast cancer in general and in India specifically?
So, when we speak about cancer in the community, there are 3 to 4 cancers that usually top the ranking of the most common diagnosis as well as the cancer related deaths. If you look at worldwide, the breast cancer ranks as the second most common cancer. The first is obviously lung cancer, but the breast is actually the second most common cancer. So if you look at absolute numbers, we are looking at 23 lakh or 2.3 million new cancer patients, predominantly women, who are being diagnosed with breast cancer. And this unfortunately translates to nearly a lakh of 7 lakhs of cancer deaths related to breast cancers worldwide. And if you look at the Indian statistics specifically, our reporting rates are not very accurate, but whatever that is being reported, it looks like we are having about 2.3 to 2.5 lakh new cancer patients with breast cancer every year. And nearly 50% of them are losing their lives because of this cancer every year at around 80,000 to 1 lakh. So this is a huge number. And if you are trying to make an impact on any cancer, if you make an impact on the breast and lung cancer, it goes a long way in making a difference for both cancer diagnosis and also to reduce the cancer related mortality. So breast cancer is a cancer that predominantly affects the women in working class women, and it usually happens during the reproductive phase and also in the postmenopausal phase. So there is no specific age criteria. So it's a cancer that affects anywhere from 30 years of age to nearly 80 years of age. So having an awareness of this cancer diagnosis makes a long way in both preventing the cancer as well as the effectively treating the cancer.
So, moving on, could you talk about the causes and certain modifiable and non-modifiable risk factors?
So any factor that increases the chance of a particular cancer can be labeled as risk factor. For breast cancer, we can divide these risk factors into something that can be modified, that is within our control, and something that cannot be modified, that we are living and born with it. So if you look at non-modifiable risk factors, this is the increasing age. As we get older, there is a high chance of getting a cancer. So if you look at somebody who is less than 50 years of age, the chance of breast cancer is something between 1 in 50. So if you look at women who are more than 70 years of age, then the chance is 1 in 15. So the chance of getting a cancer obviously increases as the woman gets older. So increasing age is one of the non-modifiable risk factors. Other non-modifiable risk factors include your own race and ethnicity that you are born into. Something like a African American ethnicity has a higher chance of breast cancer. And similarly, in India, it has not been systematically studied, but we find that certain communities of women tend to have a younger age of breast cancer or higher numbers of breast cancers. Again, if you're born into a family with already history of breast cancer, that also increases your chance of self diagnosis of breast cancer. Again, other reproductive factors like early menarche, which is the date or the age at which the woman starts to menstruate, and date of menopause. That is within not our control. This is a non-modifiable risk factor. The more the number of menstrual cycles the woman exposes herself to, the higher chances of breast cancer. These are the non-modifiable risk factors. Coming to the modifiable risk factors, these are the most important ones because this we actually can make a difference about the overall weight of a person. If the person is obese, there's a higher chance of developing a breast cancers. For every 5 BMI units, or if I can simplify it, every 5 to 6 kg increase in weight above the ideal body weight, there's a 10% increased chance of developing a breast cancer. Which also means that if you reduce 5 to 6 kgs, there is a 10% reduced chance of getting a breast cancer. It's as simple as that. You have to maintain ideal body weight, and beyond the ideal body weight, any amount of weight gain is going to put you at a higher risk of breast cancer. Again, reduced bone mineral density. Reduced bone mineral density is a surrogate for your exposure to estrogen. The more the fat in the body, this fat get converts to estrogen, and this estrogen stimulates the ductal cells within the breast, and this can result in higher chance of developing a breast cancer. So maintaining a healthy bone density, ideal bone density, maintaining a strong bones is also a surrogate for reduced risk for breast cancer. And the other contentious topic is now during the era of globalization, westernization, we find that more women are delaying their the age at which they have the first child. Delaying the age of first childbirth is also a risk factor for breast cancer. So anybody who is beyond 32 and expecting a first child beyond 30 and 32 is also at a higher risk of breast cancer. And nulliparity, completely not having a child for whatever purposes, is also a risk factor for a higher chance of breast cancer. And avoiding breastfeeding for a child, when a woman breastfeeds, there is a feedback loop that prevents the menstruation. So that in turn results in decreased exposure of estrogen to the ductal cells, and there is a reduced chance. Other habits in the form of smoking and alcohol, both are carcinogenic and they can put you at a higher risk of breast cancer. The day-to-day carcinogen in modern life is lack of sleep in the night and night shifts. So in the night shift, there is a reduced chance of melatonin in the system. And reduced melatonin can also increase the chance of overall cancer incidence, because breast cancer is the most common cancer, breast cancer per se. Other dietary habits in the form of high saturated fatty acids or high saturated fats in our diet. If fats contribute to more than 20% of the energy requirement, and also higher proportion of processed, ultra processed food items can also increase the chance of breast cancer. This is in brief the risk factors are the factors that contribute to increasing chances of breast cancer.
Thank you, Dr. Pinninti. That was really enlightening. It was very informative because I believe these days people don't know how these decisions are actually impacting their chances of acquiring cancer, breast cancer specifically. Now, coming to diet, could you discuss how diet impacts therapy or patients who've already been diagnosed with how it affects prognosis of the patients who've been diagnosed with cancer, breast cancer?
So diet is a very heterogeneous thing, and we India, being a very large country, diet changes every 50 kilometers to 100 kilometers. There cannot be a uniform dietary prescription that we can give for our community to follow to prevent a breast cancer. So we need to follow broader dietary patterns. So these broader dietary patterns can be described into something called prudent diet or Western diet. So prudent diet is something that is very rich in fruits, vegetables, a diet which is much more higher in whole grains, less quantity of processed or ultra processed packaged food items, less quantity of processed meat or saturated fats. This is called as prudent diet. If a person follows a very prudent diet, there is nearly 20% reduction in their overall life expectation of developing a breast cancer. So if you are following a westernized diet, processed meat, processed food items, packaged food items, higher quantity of red meat, processed meat, salamis, any of those westernized diet, there is nearly 40% increased chance of developing a breast cancer. So we have to follow a broader dietary pattern rather than sticking to a just one prescription of specific diet. And importantly, dietary fats. Reducing the dietary fat while on chemotherapy can also improve the outcomes of overall treatment outcomes, improving the chance of surviving the treatment. At the same time, any amount of alcohol that is consumed during the treatment of breast cancer can also increase the chance of treatment failure and also increase the chance of relapse by nearly 20%. Again, there are several cohort studies, case control studies, multi-institutional review series. One of the important one is called WIM study. The WIM study is basically Women Interventional Nutrition Study. It included nearly about 2,500 odd patients who had stage 1 to stage 3 breast cancer. And what they have followed is, in a telephonic conversation with a dietitian, they have prescribed a low-fat diet. A low fat diet is something that is described as fat contributing to less than 15% of the energy requirement. And they followed the patients for nearly 5 years. At 5 years, anybody who had a low fat diet and had been on that prescription consistently, nearly 24% reduction in the recurrence rates and also in the mortality rates. So just following a prescription of a very low fat diet, fat contributing to less than 50% of the entire energy requirements, also goes a long way in preventing a recurrence even after a breast cancer diagnosis. Excuse me. Again, weight at diagnosis and weight during the treatment and weight post treatment. This is as an impact. So obesity at diagnosis. Anybody who is having a BMI of more than say 25 is supposed to be obese. So if somebody is having a obesity at diagnosis, there is a higher chance of treatment failure. Anybody after diagnosis, if they can maintain a stable weight, there is nearly 35% reduction in the risk of recurrence. Again, this could be as low as maintaining the weight within zero point 0.5 kg to 2 kg per meter square, which could be for 60 kg person, it could be anywhere from 57 to 63. If they can maintain that, so their chance of recurrence is nearly one third, something like that. Again, physical activity. How do you describe physical activity? There are studies that shows that patients who describe themselves as physically active or tend to finding them to have less amount of recurrence. So for my practical purposes, what I describe to my patients is that anybody who is dedicating at least 150 minutes per week are physically active. So 150 minutes per week is turning out to be anything like, say, 20 minutes to 30 minutes per day. I think that is doable in our daily schedule. And if you can dedicate that amount of time during the day post diagnosis, probably their chance of developing a recurrence is less.
Right. Thanks, doctor. So, also, in your patients, when you've treated them, have you experienced if the patients they work out or do exercise throughout their treatment? Does it really impact their prognosis? Does it make it better?
So let's talk the evidence that is out there rather than impressions and looking at anecdotal evidence. There are several clinical trials. There are three clinical trials that have been with the mnemonic, very catchy mnemonic, like LISA trial, Energy trial, and Success trial. What all these trials have shown that if the patient can maintain their basal weight and not gain more than say 1 to 2 kg per meter square, which, as I said, which turns out to be around 3 to 4 kgs per a 60 kg person, they have done well, and their chance of recurrence actually has reduced. So this is something that we can incorporate in our daily practice. As physician, we can actually motivate our patients to adapt new exercises which are not very impactful, like swimming, yoga, walking, brisk walking, breathing exercises. These are all non-impactful physical activities that can have a long impact on their overall risk of recurrence.
Thanks, doctor. So now I would like to take up a question from our viewer. So the question is about cancer screening and opportunities for breast cancer screening specifically. What is cancer screening and opportunities for breast cancer screening?
So screening is something that we use in a healthy individual. It's not a diagnostic test, it's a preventive test that is done in a healthy individual with an intention to identify cancer in much more earlier stage and in an asymptomatic stage. So as per present guidelines, we have several cancers that can be detected by screening. The most important of them is the breast cancer. So the guidelines say that any woman who is at least 40 years of age, or if a woman has a family history of breast cancer, then they can start something like a 5 years earlier than the primary diagnosis of breast cancer in their family, or at least 40 years of age, and do the screening mammography yearly, and also go for a every yearly clinical breast examination. So clinical breast examination, self breast examination, and screening mammography. These are the tools that are at our disposal for early diagnosis of breast cancer. So in clinical breast examination, which is done by healthcare professionals, it can be augmented by the screening mammography to identify a breast cancer which is even not even palpable. When you go with self breast examination, we need to train the person to identify the difference in the size, shape, and form of either breast. Look for some specific signs on the skin like dimpling, puckering, retraction of nipple, any discharge, and any lumps. These lumps most of the times are painless. Most of the painless lumps which tend to progress and also involve the skin, these are the ominous signs of breast cancer. Mind you, there could also be lumps in the breast which are non-cancerous. This could be cyst, fibroadenomas, which doesn't require any treatment. And if at all the woman or whoever is doing the self-breast examination appears to be alarmed by a lump, it is better to go for a clinical breast examination followed by mammography.
Thanks, doctor. So now, before we conclude our session, would you like to give a key message for our viewers, something along the lines of screening, something along the lines of reducing the risk factors or anything?
I think a treatment avoided is the best treatment. Anything that we can prevent is the best strategy. So we cannot change every risk factor that is at our disposal. As I described previously, a few minutes before, Some of the risk factors are non-modifiable. Increasing age, family history of breast cancer cannot be changed. So for those who are at risk of breast cancer and those who are aware that a cancer diagnosis is not a death sentence, and cancer diagnosis is an opportunity for early treatment, and by doing a screening methodologies, by using a screening mammography, by using other screening methodologies, if you can identify a cancer at a much more earlier stage, it gives you an opportunity to treat that cancer perfectly and effectively, and also prevent a relapse and move on with life. So at this time, I would probably encourage and motivate most of the women who are more than 40 years of age to go for a clinical breast examination, identify and stratify the risk for breast cancer, look at their family history much more closely, and adapt a preventive health strategies to prevent a later line or later age medical morbidities like cancer. That is my message. Thank you very much.
Thank you, Dr. Pinninti, for this session, for your time, for giving us such a comprehensive overview, discussing the risk factors in depth, giving your own advice, using your expertise. Thank you so much for your time, for helping us conduct this session for cancer awareness. I'd also like to thank our viewers for sending in questions and this interactive session. And stay tuned for more episodes for the role of nutrition in empowering oncology, basically.
Thank you.
Thank you. Thank you, Doctor.